Cholesteatoma is a squamous epithelium growth that is benign, but it's an accumulation of keratin debris inside the middle ear. Most of the time, these are acquired, these are not congenital things, and a lot of patients that present with it have a history of recurrent otitis media, or chronic middle ear effusions, or history of tympanostomy tube placement. A flashback to pediatrics: if a patient has a cleft palate, remember that these patients have a lot of middle ear disease, and it can increase the risk of cholesteatoma. Basically, you have formation of a pouch within the ear, and it traps epithelium and certain debris, and sometimes it can even lead to chronic otorrhea or conductive hearing loss. So most of the time, you'll actually see on the top outside quadrant of the tympanic membrane or your eardrum this white pearly mass, and sometimes you can even see this small retractable pocket that has debris inside it. So when it comes to diagnosis, on otoscopic findings, when the cholesteatoma is acquired, you see that retraction pocket, you sometimes see the squamous epithelium and debris, and it'll show up as a brown irregular looking mass. But if it's congenital, you'll see that white pearly mass that's behind the tympanic membrane. You can assess the degree of the bone destruction itself using X-ray or CT of the temporal bone, but remember that the treatment is surgery. It's always indicated because there's a lot of complications that can arise, and the type of complications that can arise from this are facial nerve paralysis, even abscesses. Eventually it can even lead to meningitis or sigmoid sinus thrombosis, and chronically you can have damage to your hearing because the ossicles are damaged.